For a group project, we wanted to compare the numbers of cigarettes smoked per day with different ethnicities, such as Asian, whites, African Americans, Latinos, and Hispanics. We are also comparing gender, different locations, such as urban and rural, and poverty levels. Our research questions were, out of the 4 different races that we chose, who smoked the most cigarettes per day? Did males smoke more cigarettes per day than females? Did people living in urban areas smoke more cigarettes per day than people living in the suburbs? Did people who live below the federal poverty level smoke more cigarettes per day than people who live above the federal poverty level? Our survey target population was on California. We conducted our study using the 2009 California Health Interview Survey and the SPS's data source. We used chi-square as our statistical method because we wanted to investigate whether distribution of categorical variables differ from one another. According to our chart, we took 8 variables on the CHIS data to do our calculation and examined each variable individually.
Our null hypothesis states that there is no difference between ethnicities, gender, location, and people living above or below the federal poverty level. This is our chart. N equals the number of people in the survey. Then we have a minimum, maximum, mean, and standard deviation. The chi-square for gender is 0.00, which means we reject the null hypothesis. For self-reported Asians, the chi-square is 0.00, in which we reject the null hypothesis. Self-reported African American, the chi-squared is 0.00, and we also reject the null hypothesis. For self-reported white, the chi-squared is 0.00, and we also reject the null hypothesis. Self-reported Latino/Hispanic, the chi-squared is 0.00, in which case we reject the null hypothesis. For rural and urban, our chi-squared is 0.017, in which we reject our null hypothesis. Lastly, poverty level, our chi-squared is 0.458, and for this one, we accept the null hypothesis.
At the bottom of the chart, we have put the p-values. Any p-values less than 0.01 and 0.05 is bound to be significant, and any value over 0.1 is found to be not significant.
As previously noted, we have 4 hypotheses. Therefore, along with our results, we will also have 4 of our findings. With these findings, we are going to compare it to some of the most recent research and surveys to see whether they confirm or denied our study. According to the National Survey on Drug Use and Health, it claims that although African American males have the smallest population, they also have the highest smoking rate at 21.3%, compared to the rest of the population, which is about 17.1%. However, white females have the highest smoking rate among all the other races and females. Likewise, Asian and Hispanic has the lowest smoking prevalence in both genders. This neither deny nor support our claims that white smokes more than any other ethnicities. However, we must take into consideration that with our study, we're only based on the California population. Furthermore, the Center for Disease Control and Prevention also gathered data from the State Tobacco Activity Smoking Evaluation, which is a survey of about 17,000, and they have proved or they have agreed with us in our finding that male do smoke more than female. According to the study of the 17,000 population, 16% of the males smoke compared to 9% of the females who smoke. Our next finding indicate that there is a significant difference in smoking rate, depend on the location of the population. Similarly, the American Lung Association reports also agree with our findings. It claims that people living in the rural area tend to smoke more than people in the urban areas, due to the fact that it is accepted as a social norms in the rural area. This specifies that there is a lack of prevention education in these specific areas, and there need to be attention, or there need to be some kind of intervention programs to prevent this or to teach these populations. On the other hand, although our findings from the CHIS data indicate that people living above the federal poverty level, the FPL, are more likely to smoke, nevertheless, the American Journal of Public Health indicates that people living below poverty level are more likely to smoke. Low-wage workers are also more likely to smoke. The American Journal of Public Health disagree with our findings, yet it confirms with our hypothesis that people below the poverty level are more likely to smoke. Our findings have at least two limitations. First, the data we use, the CHIS data, is a survey of telephone interviews, and this proposed a population selection. People who are deaf or of hearing impaired are going to be excluded from this interview. On the other hand, people who do not have phones will not also be taken into consideration. Due to the absence of an option to respond in any other form other than telephone interviews, this will contribute to inaccuracies and to the estimates of cigarette use among some of the population or of the amount of smoking or rate of smoking. Second, our data are limited only to California residents. However, some of our literature review are a national-based survey. This means that in comparison or when analyzing both data, our results are going to be skewed.
Now I will be talking about the policies and regulations about tobacco use and smoking in California. In the state level, California's biggest example of its influence on public health law is tobacco regulation. In 1988, voters approved a proposition to become the first state to tax cigarettes to fund a tobacco control program. In 1995, California became landmark statewide for a smoke-free law called AB 13 that was passed to protect people from secondhand smoke exposure. A few years later, California banned smoking in public places such as trains, planes, buses, workplaces, and inside restaurants. Now, about half of the states have similar policies about smoking in public places. Unfortunately, there are a number of exemptions that still allow smoking in some workplaces. Employers with 5 or fewer employees may allow smoking, but this does not apply to restaurants and bars. In 2011, a bill called AB 575 was introduced to close many workplace exemptions in the state smoke-free air law. However, the bill was weakened and is held up in the Senate due to political interference. Thankfully, numerous California communities have adopted local 100% smoke-free laws that are stronger than the state law and close the gaps in indoor coverage, providing workers and the public with 100% smoke-free protection in enclosed workplaces and public places. Additionally, many California communities are expanding smoke-free protections to outdoor workplaces and outdoor public places where people gather, such as near building entrance and service lines and patio dining areas at parks, beaches, community events, and recreation facilities. For workplaces covered by AB 13, Cal OSHA is required to respond to complaints regarding smoking in places of employment only after the employer has been found guilty of 3 or more violations within the previous year. The state has some of the most restrictive anti-smoking laws in the nation and is the center for anti-smoking laws that have swept the nation in recent years. Violation of these laws can result in serious fines. Now I will be talking about the federal level regulations in regards to tobacco use. In 2006, the U.S. Surgeon General concluded that there is no risk-free level of secondhand smoke exposure and that regulating smoking through smoke-free laws and policies is the most effective way to protect individuals from exposure. In June of 2009, President Barack Obama signed into the Family Smoking Prevention and Tobacco Control Act, giving the U.S. Food and Drug Administration comprehensive authority to regulate the manufacturing, marketing, and the sale of tobacco products. The new law represents the most sweeping action taken to date to reduce what remains the leading preventable cause of death in the United States.
3, 2, 1. Damn, because it's not gonna work. I can't even read my own stuff. Smoking cigarettes. Oh my god. Wait, totally do over.
Workplaces when smoke-free. Wait. Can I just start all over again?
Good.